Yeah, so it's getting pretty real, people. It's not it's not getting any better. And unfortunately, I had that suspicion. Right, a lot of people did. China is, well, reporting the lowest numbers of anybody in the world right now. You know, the place where this all started, and everybody's on quarantine, where they are out of medical testing kits, medical personnel, personal protective equipment. The list is endless, really. So, of course, they're going to be reporting low numbers. They can't test. They don't. Most of their hospitals are overrun with this. Their staff and scientists and everybody are infected. Okay. Now, the biggest jumps we've seen here, the USA in the last 24 hours, 338 cases now. We can look at that. It's everywhere. It's absolutely everywhere. Okay? You need to realize that what they're telling you on the news is a bunch of bullshit to keep you calm. You don't need to panic, but you need to be aware of what's going on. Panicking is not going to help you, but you need to be prepared. And if you're not prepared already, you better goddamn get out there and get prepared. And my advice about getting prepared, if you're going out to your stores and stuff to get, maybe non-perishables, be careful where it's imported from, of course, and if you can avoid larger stores, try to do that. If you can maybe drive, somewhere else and go to like a smaller place where there might be less people, right? The less people you're interacting with, the better chance you have in not catching this. And the surfaces, touching surfaces, like you got to be really aware of this stuff now. You really do. And being close to people, some people aren't going to have the options right now. Everybody's going to be in a different situation, right? But you can only do what you can do and focus on what you can do. Not what you can't do. If you can't do something, don't be focusing on that, because that's not going to fucking get you nowhere, right? You got to focus on what you can do and do those things, right? Even as simple as they might be, it's going to help, right? I've been preaching about this since day one, but the data wasn't there. The news reports weren't there. People aren't going to believe some guy off YouTube just cracking off shit from his mouth, right? And well, depending, but it's rough to get that message across, right? Unless you have some solid evidence to back it up, which at the time there wasn't a lot before. But we're starting to see now this is absolutely out of control. And a lot of our data of what they're talking about, we can't rely on that. We can't even rely on these numbers that we're seeing right now, because it's constantly changing. Constantly. The US isn't testing as much people as they should be because there's a shortage of tests. They're hoping to get everything out by today. I think there is something. Yeah, they were getting tests out, but literally it's only like 500 per city. Like, that's seriously not enough. 500 per city, that's no, like, per city that you could test 500 people just coming in from the airport. Not let alone, your whole city on community level. Okay, the testing's not being done. We're seeing this thing just explode, and we're going to go through some headlines here that are, going to solidify maybe the fact that these guys are full of shit. The World Health Organization, CDC, their number one goal right now is to keep the public calm, even if that means lying to the public. Of course, you can't tell the truth and keep people calm if something's going to upset them, right? Well, that's inevitable. So what are they going to do? It looks like they're just keeping on going with what the actual data numbers are. Of course, that's all they can do. They're not even veering from this to say, well, it's probably a lot worse. But we can only go on the numbers because, that's the facts. And the facts, unfortunately, are very wrong. With our data collecting, we can't gather the data that we need to. We can't. South Korea, their numbers haven't changed very much. And do you know why? They're running out of testing capabilities. That's what's happening. Everywhere there's a shortage of tests, and this stuff just doesn't, you can't just magically make these components. Like, it takes time. And you can't rush that either, because if you rush it, then you got to start right back from square one. They already sent out faulty test kits. Apparently the ones at the CDC worked, but when they went to scale it up on a bigger level to distribute the kits, whatever happened in the process of making the bigger batch contaminated it, and it sent out faulty test kits. So right there, that's a bad data gathering. And then also on top of that, the shortage of test kits. Not to mention that the kits were faulty. And we were letting people go who were probably positive, on it's absolutely mishandled. And they weren't ready for this. Caught them with their pants down is what happened. And they denied it. And, China did the same thing. China did the exact same thing. They just kept letting it go and letting it go until it was out of control. And then there was nothing they could do. So, we're in a really tight place here. For the people who are in these big cities, I couldn't imagine. I don't live in a big city. I live, on an island, fortunately. I live on an island, and right now I feel like we're probably the least affected of any place in the world, but we have no confirmed cases, but you can't see this, right? You can't see it, you don't know where it's at, but obviously, like, this thing is absolutely global. Like, it's global. It's everywhere. It's reaching the furthest tips of places, like, it's unreal. And a lot of places don't have the capacity to test. So we can't, most of the developed countries can't test. There's no way these underdeveloped countries are going to be able to test. They might get a handful of tests. That's it. Right? And then they got to send them somewhere to another lab to get analyzed. There's going to be priority triaging going on here with these tests. Of course there is. And, they're probably not going to be the top of the list, unfortunately. Because all our labs are working at capacity with what we have for testing, right? We are at capacity. We can't go any further, but they're saying that Monday there's supposed to be like a whole bunch of tests going up. So we're really going to see the numbers skyrocket next week, like through the roof. If the US says they're going to test like they're going to test, like look at this. Like look at those dots. It's fucking everywhere. And considering the limited testing capacity we have, it's much, much worse. And you have to assume that. You can't look at this and be like, well, it's not that bad. No, you cannot. Seriously, you can't look at it like that. We have to look at this worst case scenario now. That's the only way. Really. If you want to survive this, these are the things you need to do. Right? You got to take this seriously, and you got to do whatever is in your capacity that you feel you need to do to keep you safe. Right? Watch some YouTube videos on fucking spreading the fucking germs. Actually, you know what? I got a video here for you. It's a little one.
People are staying home for a couple of days, see if they get any better.
So at this point, I think we have to believe this is respiratory. Maybe fomites, too.
What's that, fomites?
It refers to transmission from surfaces. The average person touches their face 2,000 or 3,000 times a day.
2,000 or 3,000 times a day?
3 to 5 times every waking minute. In between, we're touching doorknobs, water fountains, elevator buttons, and each other. Those things become fomites.
Is this something we want to release to the press, respiratory and fomites?
And how's the public going to react to that?
Hard to say. Plastic shark in a movie will keep people in the ocean,
so
but a warning.
all these things contribute, right? These fomites. That was a clip out of a movie, Contagion. And it's funny because this movie is pretty accurate. If you wanna watch a movie on this and just kind of yeah, it's Contagion. It's actually really good. It's got Ben Affleck in it, I think. But yeah, they talk about a lot of real situations. Also, they talk about, let's just do another one, the RO value. Because the reproductive value for this is around 3 for this. This is what they're declaring it as. It's probably higher than that, actually. But it's 3. But this here description gives an RO value of what 2 would be. So yeah, this is a good description, and it even though it isn't a movie, it's actually accurate, mathematically and scientifically.
What determine is this: for every person who gets sick, how many other people are they likely to infect? So, for seasonal flu, that's usually about 1. Smallpox, on the other hand, it's over 3. Now, before we had a vaccine, polio spread at a rate between 4 and 6. Now, we call that number the R naught. R stands for the reproductive rate of the virus.
Any ideas what that might be for this?
Tell them what an R naught of 2 really means, Dr. Cheever. Teach them some math, No? I'll do it. On day 1, there were 2 people with it, and then there were 4, and then it was 16, and you think you've got it in front of you. But next it's 256, and then it's 65,000, and it's behind you and above you and all around you. In 30 steps, it's 1 billion sick. 3 months. It's a math problem you can do on a napkin, and that's where we're headed.
Unfortunately, that is where we're headed. The RO value of this is considered 3. That little movie clip was considered, they were doing a calculation for 2. Because it goes exponentially. It increases exponentially. The virus doesn't spread at a consistent or constant rate. It increases exponentially the more people that it infects, the more that it spreads. Did you ever see bacteria ever growing under a microscope? You know, like how it just starts with a couple of little ones and then it just explodes. Like mushrooms or fungus, any of that. Like fungus is kind of the same principle as this. It will exponentially increase with the more people that are infected. So we have worldwide right now 100,000 people, let's just say. Now that's going to increase exponentially. And now how long? Is it 2 days? Is it 3 days? We could actually say, just on the safe side, let's just say 5 days. This needs to increase exponentially in 5 days. So what's exponentially of 100,000 people? With the RO or the R naught value of this, and considering the transmission factors that, you know, this can travel through feces. You know, anybody who's not practicing good hygiene could wipe it on anything. You know, we know there was a thing about the McDonald's touchscreens. They did a documentary on it about how much feces they found on the touchscreens. You know, and it's actually a very, very good method of transmission for this. And not only that, It can travel through touch. It can travel through droplets in the air, they say, which basically, if somebody's coughing enough in a small environment, they're gonna. It's the natural air movement in that environment is going to keep this thing stirred up, right? It's like dust particles. If you could imagine dust particles, well, dust particles are like bricks. They weigh about as much as a brick compared to a virus floating around in the air, right? So it's like a virus is like a feather in the air, and even it will stay in circulation, right? It will. So if you can imagine dust floating around in the air, a virus floating around the air is much lighter, right? It does maybe say travel in higher concentration in bigger droplets, but we can expect this to travel through very close contact. And if you're on the bus, you're on the train, you're on a taxi, maybe somebody else was in the taxi before you who's infected, right? How many taxi drivers pick up somebody per day? Do they go in the back and wipe off the handles of the doors? No, they don't. Do you know how many things you touch in a run of a day and like touch your face? And it's absolutely disgusting, really, because we're not even aware of it most times. But when you become aware of it, you'll notice it's a really hard thing to do. It is. It's an extremely hard thing to do, not to touch your face or contaminated things that are possibly, or I guess things that are possibly contaminated, like doorknobs, just to name a few, like door handles, everything, bathroom taps. We don't know who's been in there, who's infected, but obviously the numbers are massive. Let's just go zoom in for a second here on Vancouver. I'm from Canada, so let's just check my place first because I'm kind of biased. So 21 confirmed, and that's what's confirmed, right? And everybody's got limited testing capacity right now. They're not just testing everybody that comes through the door. It's unfortunately it is being triaged. It's the lack of testing kits is the problem. Now Edmonton's got a first case, Calgary as well. If there's one case, you can guarantee there's going to be a lot more. All right. London has one case, but that's been always like that. She's still been home quarantined. Ontario's got 27 cases. That's where Canada's next outbreak's going to be. Right there. And Montreal's now got 3 cases. So Montreal and Toronto, Vancouver are going to be Canada's hotspots. And the hotspots for the United States, wow, Seattle, damn, 59 confirmed, 12 deaths. Washington, that's a fuck ton of deaths for 59 cases, right? They obviously got a lot more cases than what they're dealing with. The nursing home is overrun with infections. Look, there's another 19 confirmed there in Washington County, Squamish County. Like, they got a big problem there, right? Facebook told all their people to work from home. Google told all their people that, the offices are closed, everybody. But the thing is, what if everybody has to work from home? Or, well, not everybody can work from home, but what if everybody has to go home? They say, they're putting in this great big fund and this big budget. But you can put money wherever you want, but if the things aren't there to buy the money, then, or if the money, if you can't buy anything, what's the good of money? Like, if the shelves are empty, do you get what I'm getting? And they got the border closed, or not border, but well, it's pretty much closed at the Vancouver. When coming across into BC from Washington, Oregon, they're doing high security checks now. They I think they turned away 100 people so far for whatever reason, and people are saying it's racist. There was a news broadcast and this guy's like, well, they're just targeting certain people. Well, yeah, certain people with the virus, like, get over it, you fucking clown. Like, it's not, like, don't bring it to a racial place. You know, we get enough of that bullshit already. Italy just took another jump. I just seen that. 46 and 200 deaths in Italy. Look at that shit. Wow. And only 5,000, like less than 5,000 cases, 200 deaths. What the fuck's going on there? Right? And Iran's got some big ones. South Korea, I really don't believe that they only got 44 deaths. I can't process that. 6,000 fucking, and, you know, like, there's probably 10,000 infected actually, or more. Because, you know, you could definitely assume that, but 44 deaths? No, that doesn't sound right. It doesn't. Considering, you know, in Washington State, in the US alone, they got fucking, how much is it? 59 confirmed and 12 deaths in Washington. All right, and this other one, there's 1 death and 19. And yeah, a lot of this is underlying issue stuff too. Like, you know, obviously some people are going to be more susceptible to this, but I think it really, you know, it's going to be, there's a lot of speculation and I have a lot of opinions. So anyways, a ton of people, just a shit ton of more countries, you know, and they're not going to declare a pandemic because what they say is pandemic is giving up. When you say pandemic, that means you're giving up. No, it doesn't. Like, the World Health Organization is switching whatever the hell context they want to try and keep the public calm. All right? And he says, you know, by changing a word, it's not changing what's going on. Well, then why did you declare a global international emergency if it's, you know, if words don't matter? You know, they did that. You know, they changed the global level, risk level, to very high. Well, why would you change it to very high if words don't matter, you know, and escalating things don't change anything? Why would they escalate it? You know, it's whatever is feeding into their agenda, right? That's just the way it is. And the biggest thing right now is to keep the public calm, even if that means lying to the public, and they are. Of course they are. You can't tell the people the truth and you know, keep them calm at the same time, especially if, you know, what the truth will probably cause people to be uncalm or panic. And that's what they're talking about, right? Well, we don't want people to panic. Well, thanks for lying to us and giving us a false sense of security. All for the reason of, you know, not panicking people. You know, that's your big directive there. You know, that's lying. It doesn't matter. It's a shit show. Unfortunately, people, it really is. And these guys are just dropping the ball because, unfortunately, the problem is that they're not ready. But they can't admit that. Before this happened, they were dealing with Ebola and a measles outbreak in South Sudan and West Africa. The World Health Organization was broke. Seriously, broke. They asked for $675 million to fund this and their costs for 2 months. And they never got the money yet. But the thing is that even if they did get the money, the supplies aren't there. We don't have big major stockpiles of stuff ready to go. They do, but they were using that during the Ebola outbreak and the measles outbreak. It was tapped already. But then, you know, we ramped up production and got things going. But wait, no, production wasn't enough. We couldn't keep up. We were like 1,000% more demand than what production could actually keep up to. It was just, we can't do it. But they can't admit that. They can't admit that. They're not going to admit fault. These people aren't going to say, hey, well, no, oops, we weren't ready. It was our job to be ready, but hey, we weren't. So, now, this is Dr. Tedros here. He's the director general of the World Health Organization. And, he does say, this is not a drill. It's not time to give up. It's not a time for excuses. This is the time for pulling out all the stops. And he said that, a couple days ago. That's hilarious. That's actually fucking beautiful. I love that. I like it. I like it a lot. It's funny. You know what? Funny thing about Pence. Funny thing. He was at he was a part of a conference where people are now testing positive. People at the conference, and this is only days after, people at the conference tested positive, and he was there, and a couple other higher ups were there. But we will get into that. So the biggest thing, well, I shouldn't say the biggest thing, but the next, the cruise ship again. They are, in fact, the whole cruise ship's infested. They did 36 tests, and 21 of them came back positive. You imagine? And they, when they dropped the tests off, the testing kits, they dropped them off by a helicopter. They just, they don't want that ship coming anywhere as close to land. It is absolutely infested, unfortunately. So what do you do? I don't know. Don't know. All right, maybe a heat-seeking missile or something. I know that's horrible. It is. But what the fuck do you do with a cruise ship? Thousands of people. Like, you just can't take them into San Francisco or wherever that's where they're out around San Francisco. But anyway, yeah, we got 2 apartment buildings in South Korea quarantined. So we're starting to see that this does have transmission through large residential apartments as well, and we've seen that in China. All right, we've seen that happen. There was reports in China, but everybody kind of said, "Oh, it's preliminary information. No, we can't go on that." And there's all these other factors. It could have been this, could have been that, could have been a lot of things. But it's definitely not traveling within apartments. That's what they're saying. But if it travels through hospitals, what's to say it can't travel through any other building? Right? We know that this thing infested hospitals. We know this thing infested cruise ships. It's absolutely ridiculously infectious. And these people, that we're supposed to rely on, are just giving us faulty data information. And they know it's wrong. Fucking right, they know it's wrong, but they're not going to admit that. The only data that they have, and they're going to say, well, it's not that reliable. Bullshit. They will not say that until it really shits the bed. And then they will come out and maybe say something. But by that time, of course, too late, right? So it's what can you do now? What can you do now? You can take the precautions that you think you should, right? And do the things that are going to help you weather this out, right? So there's not much you can do for your health except for having less contact with people. And it has to get into our body, right? If it can't absorb through our skin that we know of. Holy fuck. But it either has to get in through our eyes, and this is possible. It actually is documented. You can catch this through the eyes, your nose, your mouth, and your other openings. But basically, it's got to get in your system. And as long as you're being aware that, you're not being too close to people in crowded places, and it's hard to do, especially now that everybody's running to the store. But I did that weeks ago. Everybody around my place still isn't catching on to this yet. it's starting to hit. They're starting to get the idea. But for most part, when I started talking about this at first, people are just like, "You're so full of shit." And I told my mother, I was like, because she flies down to the Dominican all the time every spring, and I was like, no, I didn't want to really ruin her. I didn't tell her that. Well, you. But anyway, I told her that she should check into it, right? And she said, no, that's no, that's not going to affect it, right? And I wasn't going to argue. I'll just let the news and everything speak for itself. And when she goes, obviously to fly, they're gonna be warning her, right? And now people, it's not just her, it's everybody that's flying, but people are or airlines are refusing to reimburse people now. If you're canceling tickets and stuff, like they're basically being like, fuck you. Like, come on, like, how petty can you be? Seriously, these guys are all about dollars, and they're sinking, and you can guarantee that the highest of the high people are affected by this, and it's ruining their plans. They're not happy. So, of course, they're gonna sway the media to portray this that it's not so bad, because money, right? Money. Look at that. Let's look at the fucking TSX. That took a shit kicking today. Crude oil took a fucking 10% hit. 10% in one day. That's like $1 trillion fucking dollars. Pretty close. It is. It's close to like $1 trillion in one day. I'm just saying. The NASDAQ, it took a 2%. The TSX, I don't know. It did take a shit kicking today though. And the Dow, of course, like it's the Dow dropped like 15% in the last 3 weeks. It's not funny, but like, do you know what I mean? It's funny because they're just scraping at every goddamn thing they can to try and, keep the economy going and keep the money flowing and keep the industries going. This isn't a health crisis for them. This is an economic crisis more than anything. You can guarantee it. You can bet that the health of us do not matter that much to the global elites, except that it affects their money. That's the truth of it. They do not give a shit about you and me. But when they lose a whole bunch of you and me, then they start giving a shit. So, quarantine nurse slams the CDC in open letter. There's a lot of this going on. A lot, I promise. They're so underprotected and underinformed. The healthcare workers, our front line. And anyways, it's bad, right? There's so many people infected with this on so many levels. Doctors, we're going to get into one later with the doctor that went around. 70 patients he infected? And the doctor was infected, he didn't know he was infected? School teachers? Oh my fuck, it's fucking everywhere. And they're talking like the risk is low, don't worry about it. Well, Jesus Christ, you can't even go to the hospital and get a fucking checkup and your doctor's infecting you. The risk is not low. It's not even medium. The risk is high. And it's very fucking high. And they need to come to terms with that. But they're not. They're not because, guess what? Money. You got it. Money. It is. I'm sorry to say, but it is. It's fucking money is trumping everything right now. And we don't have the ability to keep up to this. It's already too late. They're not going to say that. We're using a garden hose to put out a fucking forest fire. It's not going to happen. So, writing from quarantine, the anonymous nurse unloaded on the Centers for Disease Control and Prevention, putting her on a waiting list for coronavirus testing kit. This is not the ticket dispenser at the deli counter. It is a public health emergency, she wrote. I am a registered nurse and I need to know if I am positive before going back to caring for patients. She wrote that she volunteered to treat coronavirus patients at the facility where she works at under the assumption that she would be properly cared for if she herself became infected. Could you imagine? It's almost like they treat our soldiers. You know, go to war for us. Fight for your country. When you come back home, get the fuck out of her face. Don't talk to me. That's what it is. Pieces of shit. And their global little fucking game is coming to an end. Real fast. So, and I you know, the government's the government, and, you know, people try to do their best, what they can. It's not the people. It's the motherfuckers up in the highest of levels that are toying with us right now. And it's giving false sense of security, and they have nothing better to do. They can't admit that that they're not ready. They can't, because it's already, like, it's beyond control, beyond containment, but they won't admit that. They won't admit it's beyond containment until it's beyond containment, until we start seeing people dropping in the streets like we did in China. And then what's going to happen? Yeah, don't be caught up in that shit. If you have the opportunity to move, or like not move, I'm not, don't listen to me, just fucking pack up your shit and leave. But, you know, make your own assumptions, right? I did what I did. All right. I did it months ago, actually. It's been 2 months. When I first started watching this, I knew what the fuck to do. And everybody didn't believe it. And if I was wrong, well, I was wrong. But sitting here today, looking back in hindsight, I was wrong. I was wrong that it's actually a lot worse than what I thought it would be. This is spreading quicker than what I thought it would. In 7 weeks, it has encompassed the globe. 7 weeks. Weeks. Not months. Do you know how long it took SARS and Ebola and all these things to get off the ground? It was a long time. Like, this thing has trumped every disease so far that we've known. Everything in recent history. And we know the death rate is actually much higher. It has to be. So she... Oh, sorry, I get back to this later. I really have a stick up my ass for the government right now at the highest levels. Not, you know, like, I'm sure our state level and provincial level are doing their best they can, but, you know, at the highest levels, they're shit in the bed. So, though she wore protective gear, according to the letter, she started to feel sick. And since her symptoms lined up with what other COVID-19 patients were experiencing, she was put on a 14-day quarantine. That's when trouble began. According to the letter, CDC authorities refused to test her because the puzzling rationale that if she'd been properly wearing her protective gear, she wouldn't have gotten infected. Could you fucking imagine them saying that to you? Do you know what? They're saying anything they can because they just don't have the tests. And they won't admit it. They don't have the test to test people. That's why they're doing these ridiculous things that seem so over the top. Because it's just excuses. The anonymous nurse found that explanation outrageous. Of course you would. How is she supposed to go back to work? She wrote if she doesn't know if she still could be infectious to patients and other members of the staff. I am appalled by the level of bureaucracy that is preventing nurses from getting tested, she wrote. The level of bureaucracy is happening at the World Health Organization. Those are the most bureaucratic people you could possibly imagine. And bureaucratic meaning strictly by, like, these over exuberant policies. It's a bunch of red tape, in other words, right? You know, that's a healthcare decision that her doctor should be making. And my country health department, delaying the test puts the whole community at risk. Of course. Like, it's happening everywhere, though. That's just not that one doctor. We got a lot of people. What the hell? I don't need that many columns. What's this for? Oh yeah, Sonoma County test kits. Oh yeah, Sonoma County just got their test kits. And how many did they get? Let's just see. Good news. We finally received the COVID test kit, which enables us to test for the coronavirus locally. I want to give a huge shout out to Mike McGuire, Congressman Mike Thompson, and Sonoma County, blah, 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 blah. But look, we received 220 tests. 220 fucking tests. That's what they got. Testing will begin tomorrow. Test capacity is 14 patients daily. Daily test capacity, 14 people. Takes delays of 1 to 2 days for shipping and backlogs at the CDC. Of course, you gotta check for backlogs. These people wouldn't be getting tested fucking for like another month or two. You imagine? 900 additional tests are on order. Well, isn't that beautiful? They're on order, but when are they coming? Monday to Friday test results will be available next week, same day, if the sample arrives in the lab by 9 a.m. Weekend testing to be determined. Weekend testing to be determined. I think you should be running this shit 24 hours a day, 7 days a week. But they, obviously they can't. Weekend testing to be determined. It's unbelievable. Fucking 220 tests. Oh. They got a big problem. They're not ready. Look, I can color a picture. Like, what the fuck? He's at the CDC. Look, he's not wearing his tie. He's got a blazer on. The shirt's unbuttoned. It looks like he's giving up. His little buddy here. Look at these guys in the background. They're all smiling. They're all happy. Everybody's smiling. Smile for the camera. This guy here looks pissed, though. I don't know. Just a goddamn joke. So 2 people test positive have died in Florida. So Florida's got two deaths now, but that's kind of older news. Iran's Revolutionary Guard is looking to seek absolution in virus fight. So basically, Iran's National Guard wants if the whole, because their cabinet and their leaders and everybody are all infected, like all their government officials, like they're all infected because they don't believe in wearing masks and like their religion and stuff, right? And it's just silly, and they all are infected. So now the Revolutionary Guard wants to take control over the whole thing in case the powers that be come out of power. So yeah, anyway, they just want to make it a military state, which it already was. It's Iran, but it's to have some kind of control, I guess, if you lose all your top officials. Province activates advanced COVID-19 response to protect British Columbians. Yeah, British Columbia's got a big problem. They're right on the border with Seattle and Washington. They got a big problem. And now we're seeing Canada exporting cases to the US and the US exporting cases to Canada. So it's getting crossed so bad now. Like, we're getting cross transmission. And it's just wow. It's a lot, people. It's a lot. Most of Canada's new cases are linked to the US. New cases, right? The new cases. Most of the new ones. There's only about 7 or 8 of the new ones that are linked to the US. But still, there's probably a lot more. Those are the ones that we're catching. Alright? We gotta realize that we're not catching every one of these. And people who are infected don't even know they're infected most of the time. They're just out there spreading it around. It's fucked. It is. And they're saying the risk is low. Canadian military is preparing for the coronavirus. Shifts to pre-pandemic planning. Yep, it's gonna happen. Coronavirus mutating. Yep, it's gonna happen. Let's see what a mutation video looks like. Another movie clip.
Whoa, whoa, whoa. Where did you come from?
It's mutated.
Which way, better or worse?
It's moved into an African HIV/AIDS population. The Durban cluster is highly divergent. We even knew R naught, Ellis. It's not 2 anymore.
Yep, that's what happens. Even though it's a movie, you know, it's a good movie. Contagion. If you haven't seen it before, it's actually not bad. And The Crazies. The Crazies is a good movie, another viral movie. Viral outbreak movie. Yeah, it's not bad. So Beijing is confirming that this is infecting nervous system. I don't know, but we just know that this thing is batshit crazy. There's a lot of science, and a lot of people aren't going to understand the science, so I'm just not going to. I don't even really understand a whole lot of the science, so. But I know that it's not good. 2 schools out early as parents test positive for coronavirus. Yes, in the United States, elementary school, 2 parents tested positive. They're sending their kids to school. They infected their classmates. They infected their teachers. They went to gym. They did activities. They got a problem on their hands. And unfortunately, there's a lot of mixed information about whether this affects children and how it affects children. It actually affects everyone equally. You know, people with underlying issues are obviously going to have, you know, a greater risk. It's the same as exercising. You know, older people are going to be at greater risk to exercising as well. You know, that's logical. All right, but at the same time, this affects everyone equally. You know, it's going to take the older people out first, of course. But yeah, I'm highly suspicious about these recovered patients. We're not hearing too much follow-up from these recovered patients, are we? Yeah, so the family is following quarantine protocol. Children show no signs of illness. Well, does that really matter? No. If your parents are infected, it's goddamn most likely kids are going to be infected. Yeah, and here is through fecal shedding, right? So, you know, somebody went to the bathroom, didn't wash their hands properly, who was infected with this, and if they're touching things like, yep, big time. That's probably one of the highest transmission methods, if, you know, or viable transmission methods, I should say. It would probably live the longest this way on surfaces. 2 strains of the virus identified. 70% infected by the more aggressive strain, experts say. It's just going to be a matter of time. Unfortunately, and a lot of people aren't paying attention, and you can't get them to pay attention. Like, some people on Twitter are just fucking butthurt all the hell about, you know, people calling this, making a bigger deal of this than what it is. Everybody's like, it's just, you know, people, like, I shouldn't say everybody, but a lot of people are saying it's just the flu, and like, everybody's overreacting. This is kind of crazy. Like, what the hell? Well, I'm glad that you have that sense of silver lining, but I think that they know that they're lying to themselves. If they're watching the news, you would be. And people will do that. People are going to deny this because they can't handle it. They will, because this is the big one. You know what? I'm going to tell you, it is. This is the one that we've always feared, and it's here. And they're just not going to tell us that because it will cause chaos, panic. All right, they're going to wait until everybody's sick, and then nobody can do anything because everybody's just going to be sick. That's what happened in China. They don't have the test kits. They never did. They had some, but then they were faulty. Ugh. It's disgusting. I'm telling you. The highest levels, they dropped the ball, and they weren't ready for this. And we're paying the price for it. And they're lying to us. Oh, look at this. Can you imagine? These guys are closing their schools, but the risk remains low, according to public health officials. Remains low. Well, let's just see what low looks like. Holy fuck. Risk is low, everybody. Just so you know. That is the world right now. We got dots out in the fucking ocean, for fuck's sakes. Iceland, like, come on. If it's in Iceland and they got 45 cases, it's goddamn everywhere. Look, Faroe Islands, where the hell is that? I don't even think nobody even knew that was there. But they got a case. Do you understand how far and wide this has reached? And it is at every level of your community right now, in your cities. But they're not going to tell you that. Why? Why aren't they telling us? Money. Because these numbers aren't that bad. On a pie chart. In an executive's board office, on a table somewhere, comparing trillions of dollars to, even if all these people died, well, fuck it. They're worth a few $1 trillion. For sure. We'll just let all those people die. It's all good. The numbers aren't bad. The risk is low. Don't worry about it. Numbers are great. We have no test kits. We can't test. But that doesn't mean anything. If as long as our numbers stay low, then we don't have it. Or we have little of it. So the less testing we do, the better. In a financial boardroom. Now, you put this same file on the fucking desk of a healthcare practitioner, and you're going to have two different views here. All right, and that's where we're at. We're balancing health between finances. And health should trump finances, because without fucking health, we can't even get finances. Finances can't work without people. People need to be protected before finances. I'm sorry. If you want the finances to work. If not, the finances just don't work. Because the people don't work. It's a fucking catch-22 situation here that we're in. You know what I mean? Keep the markets rolling, keep everything sustained. But you know who did this? The global powers fucked us. Because everything became a price battle, or a cost battle. So then they started exporting, buying really cheap shit from China and buying stuff from overseas. Instead, we stopped making it in our own countries because it was just cheaper to do it this way. And it made the big executives more money and fucked the little guys over, like the people. It was good for their pockets, that they were bringing in all this secondary or second-rate material and everything, right? It was all for a better cost, and now we're so dependent upon this web of transaction to take place that once it stops, everything stops. We can't even do it in our own country anymore. We're dependent upon other countries to have pharmaceutical fucking active ingredients. And, we depend on India for most of our stuff, and China, but India depends on China for APIs, active pharmaceutical ingredients, to make the medications. And if, it's I'm telling you, it's a fuck show. It is. We're fucked. And they fucked us. It's just all there is to it. They line their pockets. I'm sure they realize the risk of interconnectedness and flowing on such a very, very delicate system, very interconnected system. And now that the connections are stopping because, everybody's getting infected and we have to close borders, we no longer have the capabilities to do the things we need to do in our countries that we once did. Back in the 70s and the 80s and the 90s, the US made their own pharmaceuticals. They made most of their own shit, but then they said, no, it's cheaper if we do it this way. We'll still charge the same price, but, it'll be cheaper for us and we can make more money. That's what they did. And it was great until something like this comes along. And yes, animals can get this now. Not just dogs, animals. They figure that if it can infect the dogs, it can infect other animals as well. So, yeah. Well, it's just a shit show what's going on. More hospital staff quarantine, dozens of hospital staff quarantine. They're not ready for this. All schools are closing March 5th. This is North Shore School District in the States. All schools will be closing in the North Shore District beginning Thursday for up to 14 days. For up to? No. For at least 14. So they just closed a ward in this hospital. There's 35 healthcare workers contracted the virus. Cool. So this year's Darcy Burner, I hope she doesn't mind me sharing this, but it's on Twitter. I live and work and run a biz in the east side suburbs of Seattle, which is ground zero for the SARS, local hospital isolation rooms are full of COVID patients who haven't been reported. We are quickly approaching the current capacity of hospitals to treat people. There are far more cases than are being acknowledged based on patterns of spread seen in China, reported in the WHO report. We were probably looking at 1,000 to 2,000 cases or more. I'd say that's a conservative number. She says that there's between 50 and 150 people hospitalized on oxygen and airflow ventilators right now because of the disease. And the people who aren't hospitalized are currently spreading the virus largely unchecked. Of course, we know that. This is an exponential growth problem. Roughly every 6 days, we get another generation of infections that's more than 2 times the size of the last generation. Yeah. So we're talking about 50,000 people hospitalized from this one cluster. We don't even have the hospital beds to support that, let alone a bunch more. It's just going to happen. And, these are older ones from March 3rd, but, saying make coronavirus testing and treatment available for everyone. They did that. Yes, they did, but they don't have the tests, so they can't test. You can make it as free as you want, but the tests aren't there. They're not there. So China took their people from their detention camps because all their workers are infected. So they're putting them into factories and trying to get them to go to work. Trying to train these people to make fucking, I don't know. They were in a concentration camp their whole life pretty well, and now he's moving them into factories and going to try to teach them how to make stuff. I guess you could, but how long till they're infected? This is from the Harvard Gazette. Harvard School of... Yeah. And they even say it's going to miss 2/3 of the infected. And that's right from fucking Harvard. Right? You can't get any better of a scientific fucking report, I don't think. Most countries' procedures miss 2/3 of travelers. And not only travelers, the cases in the community. And it's probably a lot more than 2/3. So we got army members testing positive. Fantastic. And their service member and their families. So, oh yeah, here's the U.S. Secretary of State. This is new. References fueling U.S.-China tensions. I think this one is this the new one where he got tested. There's a no. Oh yeah, no, he's referring to the Wuhan virus. Yeah, he keeps calling it the Wuhan virus, and China's pissed off about that. Who cares what China thinks? Fuck off. So, Starbucks employee in Seattle stores diagnosed with coronavirus. How many people go? It's Starbucks, right? How many fancy people go in there to get their coffee every day? And their food, and this person's in there infected, making your shit, touching your coffee lid. Oh yeah, I haven't got a coffee in months. I haven't eaten out food in months after I found out what was going on. I just didn't. And it's not that I'm a hypochondriac or, overly fearful of viruses or disease. I just understood the gravity of the situation from day fucking one. And I couldn't convince other people. Everybody thought I was foolish. They did. They thought I was fucking bananas. I don't think they're thinking I'm too fucking foolish right now. But a lot of people will still deny it right to the very end. Alright, cruise ship passengers in limbo off San Francisco awaiting coronavirus tests. Like these guys delivered the tests via helicopter. They don't even want them coming to shore. They did 33 tests, or 36 tests actually, and 21 of them came back positive. That whole fucking ship is infected. What do? We got like 3,000 people on that ship. Were you just going to dump them in a hospital somewhere? No. Going to send them home? Well, you could. Strongest evidence yet that America is botching coronavirus testing. Well, we don't have to read this huge fucking article, but yes, they are. I don't know what went wrong this time. And this guy is Thomas Frieden, director of the CDC. Don't know what went wrong. And then they stopped reporting the numbers. Last night, CDC resumed reporting the numbers of tests that the agency itself has completed, but did not include testing by state and public departments. They're trying to keep the numbers down in every possible way. We understand that. And there any way they can deflect blame or anything that, I don't know. There's just so much, right? It's fucking, it's sad. It really is sad. 21 test positive for coronavirus on cruise ship off California. Oh yeah, 3,500 people on board. What are you gonna do with those people? But they're all infected. Everybody. You do 36 tests? Where was the test? There's a number for the test here somewhere. Yeah, I'm not sure if it's this article or another one, but they only did 36 tests. Lebanon has given up containing the outbreak and has moved to mitigation efforts. So that means they've given up trying to contain it. And now they're just going to save what they can. And only 16 cases reported. And they've given up. So, yeah. And this is Iran. This isn't China. This is Iran. You know, Iran's hospitals, they're just overflowing now too, right? Just like China. It'll be just like that in the US. Well, maybe not. They'll probably have military in the US fucking shooting people if you get too close to the hospital. I don't know. They're definitely not going to be fucking around though. And you can guarantee that they're getting ready to mobilize military if need be. And they will treat us just like they treated the people in China. Yeah. But there is okay, yeah, so there is where is the one with, I don't know. But anyways, 2 baggage handlers test positive at the airport, you know. It's just spreading everywhere. First Vatican coronavirus patient attended big conference last week. So Vatican said on Friday that a patient in its health services had tested positive for coronavirus. So somebody in their health services. And they were at a conference last week. You know, it's probably not a nurse. It's probably somebody who's, you know, higher up. Vatican said the patient had participated in an international conference hosted by the Academy last week at a packed theater. Yeah. You can't track that. You can't do nothing about that. But there is, well, I don't know where the news article went about Canadian health officials stress that it remains low. Like, fuck off. You're stressing that it's low, are you? You're desperate to keep people calm, desperate to lie to them. The risk is low from what we're seeing on actual figures. But what about taking into consideration what we're not seeing? What about the cases that we're not catching in the community? Right? We're not catching them all, obviously. So who's infected? We don't know. But hey, just keep going just the way you're going. Don't worry about it. Because why? Money. Things need to keep rolling. If things shut down, well, then their whole plan shuts down. I don't know. It's going to shut down one way or the other sooner or later. Sooner than later, actually. And I'm not trying to be a pessimist. You know, I really are being a pessimist at this and looking for the worst things. It's actually, the worst things are very, very prevalent. You don't even have to look. But we need to be talking about them, and the world isn't talking about them. And then when you do talk about them, most people label you as a conspiracy theorist or you know, something. You know, you're just not telling the truth because people can't handle it. They don't want to handle it, right? But they're gonna be able to handle. They're gonna see it firsthand, whether they want to or not. You know, this isn't something that you can just shut off because you choose not to see it. If you choose not to see it, it's probably going to be worse for you, right? Because when you do decide to do something, well, maybe it's going to be too late. It's unbelievable. The numbers are just spiking all the time. All the time. Anyway, I'm going to leave it there with that. We got a problem on our hands, ladies and gentlemen. Yes, we do. That's a sad picture. You know, it's not going to be long until it's big blobs like this everywhere else. Like, the only place that had these big blobs was China. You know, there was a little dot here, a little dot there, but now we got big dots. Now we got big dots in Toronto, big dots in New York, big dots Vancouver, big dots Los Angeles, San Francisco. It's all over the fucking place. So, don't listen to what these people on the media are telling you about the risk is low. Because they're so full of shit. Because they don't have the capacity. They were caught with their pants down. And, hey, they're not going to admit it. So, take care, everyone. And I appreciate you for listening, for watching this. 8 viewers. Wow. Pretty consistent. You guys are awesome. Yeah, no, you're right. The World Health Organization is being straight up about it, and Tedros does say here too, right? Like, and he does. He says this is not a drill. It's not time to give up. It's not time for excuses. This is the time for pulling out all the stops. But at the same time, they cushion it by reassuring things and stroking China's ego. China's doing such a great job. China's doing good. Everything China does is great. But you know what? They have to play nice with China. Because if they don't, China can just say, fuck you. And whatever limited communication is happening at the time, they can just pull it away. And not only that, China is one of the biggest manufacturers of pharmaceuticals. They need China to play nice with India so India can get those things and start making some medicine for the rest of the world. Because there's no factories or laboratories that we could just pop up and start making these APIs that are required for pharmaceutical ingredients in China, right? So we got to play nice with these guys. It's a very fine line to tread on many levels, but don't listen to the bullshit, because it's bullshit. Unfortunately, take your own risk assessment and do what you feel like you need to do. Nobody can make you do anything, but stay aware, stay safe. Thanks for watching. Peace.